Hi, my name is Dr. Mobin Master and this is Victorian Dermal Group. I am a cosmetic radiologist and a cosmetic doctor. So an anti-wrinkle injection or botulinum toxin, it's called a neuromodulator, as in neuro, which is neurological, brain, and modulates. It changes what the brain does to a muscle. So that actually reduces muscle movement and reduces damage to the skin and stops the skin from wrinkling. So that is an anti-wrinkle treatment. A dermal filler is increasing the volume of parts of your face wherever we've lost volume, or we want to create some symmetry, or you want to create a bit of a change or an improvement. I'd be lying if I said it didn't hurt at all. It depends on what you're having done. So anti-wrinkle, botulinum toxin, usually I use a very, very small needle and I try to do it quickly, and sometimes I use a device which is a little vibration device, and the brain thinks that it's vibration and not pain because the nerve fibers with vibration and pain travel on the same ones. So it's minimal, like little mozzie bites or something like that. Dermal filler is a little bit different. It can feel uncomfortable when you're using what's called a cannula. So that is a needle that's blunt and it goes under the skin and we burrow it through into the skin. It feels a bit weird, but it's not too bad. Again, a few stings here and there. If you're doing individual dermal filler injections, say for example in the cheeks, I find that a bit more accurate for my practice. That can have small stings, but it's got anesthetic in the product, so as you go, that same area becomes a bit number. I think it is actually possible to make your lips look natural and fuller by working on definition and structure rather than working on volume. Everyone seems to be about volume and creating these sausages that are just sort of stretched out like this, and the protrusion is one of the biggest problems as well. So it depends on the technique you use. I use what's called a keyhole technique, where my injections are all from a different type of direction, and I also work on the Cupid's bow. And I make sure that the top lip is not bigger than the bottom lip, because naturally the bottom lip should be a little bit bigger. I also top up the bottom lip after the top lip later down the track, because my theory is the reason why all these girls are walking around with top lips that are bigger than the bottom is because the bottom moves, and so it dissolves a little bit, whereas the top doesn't move as much and then the top stays. If you've tried injectables once, it won't make you worse, it won't cause any major issues. Depends on what you use. Anti-wrinkle botulinum toxin wears off after 3 months, sometimes maximum 6 months, but it takes you a lot of time to ease off the injections and for it to last longer because you alter the habit. So in short, anti-wrinkle treatment, a single try, and if you don't do it again, generally speaking, I can't see any issues with it, but most people will be back. And filler with regards to cheeks and various areas, again, there's no long-term significant effects. The first 72 hours are the most critical, and it's critical that your injector is available 24/7 after those first 72 hours, just in case there is an issue, in the rare occasion there is. So these wrinkles here, up here, they can be quite tricky and it depends on the face. So it's up to the visual eye of the injector to work out what is the most ideal. The answer to everything is not increasing volume. Everyone just increases volume and you get like cheeks and cheeks and cheeks and these chipmunks. So a bit of volume can be lost around here when we get older, but these little wrinkles around here, if you are younger, for example, I would use anti-wrinkle. But if you use too much anti-wrinkle down here, when you smile, this muscle pulls up the cheek. And if you put anti-wrinkle there, it stops the muscle from moving. Then when you smile, the cheek won't come up anymore. So it's critical for your injector to know, and there's not a short answer for that. Q-switch and a few other laser treatments for pigment and fine lines. Your under eye serums are critical as well. Skin care is critical, and I use all of these approaches to get the best result. So under eye is actually quite a problematic area, and everyone complains about it. No one likes their bags and they're sagging under their eyes. And so the first point of call, depending on the age of the patient, it's all variable and it depends on the patient. And that's why I keep emphasizing that. There is not one answer, there's not one treatment. And when you go to an injector, you've got to be very careful to choose one that adapts to your face and has a good eye. If they use protocol, the same for everyone, it's not going to work out well. So if you have a look here, what happens is if you get sunken eyes, this area along the cheek, and you've got lovely cheek, beautiful cheeks already, you don't need more, you don't need larger cheeks, and a lot of people will just simply fill the cheeks. However, if she had sunken eyes here, and this area here was missing a little bit of volume, you put a bit in the cheeks there, and you also put a little bit further back here, OG line, especially for females, and that will hide the under eye. So the idea is to hide the under eye. If there's swelling under the eye or there's puffiness, etc., you have to consider eye care, skin products, Q-switch, and other types of solutions. I've had a number of cases and complications that I am currently treating where the dermal filler has actually found its way into the orbit because a cannula was popped in there, and it can just happen. It went into the orbit and I'm having to dissolve it under special image guidance, which is a specialist area. So for under eye, cheeks is the first point of call if there's room. If there's no room, then you've got to consider other treatments. I do sometimes do under eye from here to about there. I never feel in the tear troughs because of the complication rate. Obviously, you have to do your own research, see what's online. You can look at Instagrams and you look at pictures till the cows come home, but I think you need to look at qualifications, look at the art and their style and see that their style are good. Have a consult with them. Make sure that they have a consult and discuss the whole face. They don't just come at you with a needle. If they're coming at you with a needle, they're in a rush, they're trying to get the numbers through. The other, if you really want to do full investigation, and this is just something that I've thought about, is do they deal with complications? Do they have dissolver? Do they have, it's called hyaluronidase, hyalase. So hyaluronic acid is what dermal filler is made of, and it's a building block of your body, but it's cross-linked so it doesn't dissolve. So it dissolves slowly. Hyaluronidase dissolves this product, so if they don't have it on site, then they don't deal with complications and they have to palm it to someone else. Are they available after hours? If they're not available after hours, if you have a problem, you have to go to an emergency department, and emergency don't know the first thing about any cosmetic type work. So I think that is one of the most important things. Do they deal with complications, or do they know what to do in the event of? So anti-wrinkle or botulinum toxin lasts anywhere, it kicks in from 24 hours to 3 days, and the final result is usually 7 days after the injection, and it lasts anywhere between 2 months and in some people up to 6 months. The average I find with my patients, it's around 3 months, depending on the product you use. There's quite a number of products which I'm not allowed to mention on film in the market. There's about 3 now, I think 4 have come up. The most common one that everyone knows tends to be stronger. It tends to last a similar kind of time, but what I find is the product that everyone knows the name of tends to be the only one that you can use once you use it for a couple of years. No other product will work after that, which is interesting. I don't think they designed it that way, but once you go to that stronger product, the one that everyone knows, like the Coca-Cola version, there's no going back after a couple of years. So that's an interesting observation for me anyway. Dermal filler, I believe, depending on the product and the location, so where there's a lot of movement, it tends to dissolve. So bottom lip tends to dissolve, around the mouth it tends to dissolve quite quickly, and around the cheeks. It is temporary, so hyaluronidase, we can dissolve as much as we can, but I believe that they last, yes, 6 months at maximum volume, to 12 months to up to 18 at maximum volume. But I don't think they completely dissolve for years, because I'm looking at actual imaging. Very few people are actually looking at imaging, and I'm studying the images of some patients that have had their lips done 2 or 3 years before and the lips are completely full after 2 years and they haven't been touched. So I think we're going to have some interesting stuff moving forward, and I feel that in my practice I spend more time and want to get it right and start with generally temporary filler that still lasts, but the more long-lasting ones I spend more time because I know that's going to be on your face for a long time and it's going to be a bit tricky to dissolve. Okay, so the common areas where areas are treated for wrinkles versus dermal filler for volume and volume loss. Generally, wrinkles can improve with dermal filler a little bit, but overall it's the anti-wrinkle or the botulinum toxin. So the common areas when you first kick off: frown, the forehead, so raise your eyebrows, frown, angry, so she's moving a little bit, and sometimes the crow's feet, but I generally start with there and the forehead that bothers people. There's static lines, meaning that she has no static lines. It's fantastic. But when she moves, frown, yeah, you can see that there's dynamic lines. So I only treat once the static lines start. Just because you're moving your face doesn't mean it's bad. And I think people feel that they have to be frozen and, oh, I'm moving now. Eventually you can actually kill a muscle if you keep using the same dose over and over again and don't adjust your doses. So movement is okay, it's just the static wrinkles we want to get rid of. The crow's feet, smile really hard. You don't have any at all, but the crow's feet around here and around there can be treated again with botulinum toxin. Volume, what I usually do in the most common place for injections for me is in the lips, usually for lip enhancement. I generally work on structure, make sure I've got a nice beautiful cupid's bow as she has, and get these filtral columns, those 2 columns there. And I also do the bottom lip and I put a paddle pop stick in the middle so that you get the Angelique Jolie little curve in the middle. That's my style as well. The other more common area as well is when your under eye is starting to show and everything starts falling down a little bit, you're getting the jowls and all this kind of stuff. I put some filler in the cheeks and start from here to here, just to pull everything back a little bit. And that's pretty much the most common areas to have treatment.